a great question. The question is there a certain age where you wouldn't treat prostate cancer? And yes, prostate cancer is a very slow growing. And when guys have non-aggressive forms, we look at what's their life expectancy, because we can basically make predictions based on the grade and stage of the disease where, I don't mean to be rude or crude, but you're more likely to die with it than die of it. And if you're going to die with it, there's no point in putting you through radiation or surgery or any medical treatment because it's not going to kill you. And I think that is a big problem in the U.S. is that we tend to overtreat it. We don't need to treat prostate cancer in everybody. In young, healthy people with intermediate or high-risk disease, we do. Because it goes back to that snail graft. Some people stay like that forever. They'll just stay with them and they'll die of it. There's a great study. It was actually done at Wayne State, and it's pretty cool. It's another cool study that I really love. It's done maybe 20 years ago where they did autopsy studies on trauma victims. So these guys came down to DMC. There's this great pathologist there, Dr. Socker, and a group down there where they were doing autopsy studies on all these trauma victims, gunshots or car accidents, and they looked at the rate of prostate cancer. So a young kid would come in, whatever, have a trauma, die. They would do an autopsy and look at his prostate. 30%, almost 30% of 30-year-old men, they found prostate cancer in. So if you look for it, and then as you get older, it's more prevalent. But the point is that prostate cancer is very prevalent. If you look for it, you'll find it. The challenge for us is when to treat it. When does it need to be treated? And that's kind of the next frontier for prostate cancer treatments, is using a lot of these new biological markers. We have new blood tests, we have new assays where we look at the genes of the cancer and can predict with better certainty what's the chance that they have worse disease, what needs to be treated, and what can we follow.